Hi, Dr. Stephen Gowdy, Pediatric Ear, Nose, and Throat Surgeon and Chief Medical Officer of Dr. Knows Best. So during the wintertime, everybody doesn't want to get sick, but everybody ends up getting sick. And so, if everybody's sick and they have coughing, sneezing, fever, everybody's miserable, and you are always asking yourself, how can I avoid this? How can I reduce this? Some of the level setting that we just need to do is, as physicians, is to tell you, getting sick is normal. That happens a lot. If your child is young, they're going to get sick 6 to 10 times a year, maybe more if they're in childcare. So that's just normal. It's not something to be unexpected. It is hard to get through. If your child is getting sick really often, or he's getting sick like very severely very often, then you may need to have a conversation with your pediatric provider to say, is there something going on? Does my child's immune system work correctly? And so on. If your child has had vaccines, they can actually check your body's response to vaccines to see if your child's ability to fight off those infections is normal. But what are the things that you can modify that will help reduce the likelihood of infections in your child during the wintertime? Hand washing, we've all been washing our hands a lot. You know that that's important. So, cleaning off any surfaces that, if you have friends over or what have you, make sure you clean off all of the surfaces that anybody else may have touched, during their visit, so that, if there were some viral particles or what have you sticking around, that you get rid of those. Making sure that if you have older kids in your house, so when they come home, they're washing their hands. If you have a young baby at home, don't let anybody kiss your baby in the face. And even maybe your toddler or your 3-year-old, if they want to kiss the baby, you just need to wait until that viral season is over. RSV is a significant problem, particularly for the young babies, so you may want to think twice about that. And, obviously a polite conversation to inform your older children why kissing your little baby may not be a great idea. Saline, just to physically wash out the nose, is a great idea. That will help get rid of any viral particles that are in there and kind of wash them out. If your child does have an illness, saline is really helpful to reduce the likelihood of a sinus infection, because it's physically kind of cleaning out or washing out the nose, and it's letting those sinuses drain. Humidification, particularly during the winter, is hugely important. So if you do get a humidifier, make sure it's one that's easy to clean. And understand that humidification really should be between 40 and 60%, because humidity lower than 40% can make the airways irritable. Higher than 60% can lead to allergens, asthma, mold, and those kinds of things. So really keeping between that 40 and 60%. If your child has a bad cold, cleaning out their nose with saline and a nasal suction device, whatever you have at home, obviously we have the NozeBot, will really help your child humidify that air as it goes into the lungs, and hopefully reduce the coughing that may happen. Because if they're breathing through their mouth, they're really not humidifying that air as well. And it's going to make their lower airways more irritable. So during the winter, it's really about reducing exposure to the best you can, cleaning surfaces. If and when your child does get sick, cleaning out the nose, helping that lower airway heal, making sure they're well hydrated, making sure that you have talked to your pediatric provider about the types of medications that you all can use to control the fevers, and then they'll feel better, they'll eat better. Because again, hydration is super important, rest is super important, nutrition is super important. So, optimizing that, and also taking care of yourself, right? So if you get totally run down and sick, then they're going to get, you're going to be sick, they're going to be sick. It's not going to be all that much fun. And so really giving yourself some grace, and then helping the whole family get through it. So, viral infections happen. You can mitigate the occurrence by wiping down surfaces, cleaning hands. You can also reduce the likelihood of sinus infections by using nasal saline, and then make them feel better by just controlling the humidity, cleaning out their nose, controlling their temperature, and again, it's self-limiting, and it will get better. So follow us for more great tips on Dr. Knows Best.